What are the most common types of objects that are accidentally left inside patients during surgery? And maybe, are there certain surgical procedures that are associated with a higher risk for that?
Yeah, I'd say the two most common are uh, surgical towels, which hospitals refer to as sponges, even though they're, when you see them, they're actual towels. And the other thing are clamps that get left behind. So, um, most commonly, this occurs during abdominal surgery because of the size of the abdominal cavity, and the surgeons don't do a very good job of looking, through the entire cavity to make sure that there's nothing left behind. So those the most common things are towels and clamps. Most common surgery would be abdominal surgery.
How is it that you've discovered this after the fact? You've had the surgery, you're sewn back up again. How is it usually discovered that something was left behind?
Well, the patient usually has either one of two things: either chronic pain, in the abdomen, or radiating someplace else, and the complaints can go on for months or years, or an infection, because any kind of foreign, object in your body is a site for bacteria to collect and cause an infection. Uh, so usually, these complaints go on for a while, um, but and then it gets investigated. But sometimes, I mean, we've had cases where people didn't even realize there was something left inside of them until they, uh, have an X-ray done for some other reason, and it shows this object will show up on, especially like with a clamp, will show up on an X-ray pretty easily. Anybody looking at X-ray can look at the X-ray and see, a surgical instrument or a clamp and say, oh yeah, that's what I thought it would look like.
Yep. Are there counting procedures that are in place to help try to prevent, retained surgical items? And where in the process do failures in that process happen?
Absolutely, there are. The surgical nurses are responsible for keeping track of how many instruments, clamps, and towels are used during the surgery, and then there's three times when everything's counted: at the beginning of the surgery, just prior to closing, and then at the end of the surgery. They're required to not just count how many instruments are used, sponges, clamps, but they're also supposed to document that in the medical chart. And the failures, I'd say, from what I've seen in the cases we've handled, most often there's failures when there's a shift change during the surgery. So the new nurses come on or take over for the other nurses, and things don't get documented or things don't get done. And I'd also say every case that we've had, there's been kind of a lackadaisical approach to the counts. A lot of times they don't actually count; they just write down the same number. In every case we've had, they just wrote down the same number that somebody wrote down at the beginning of the procedure. They write it down at the end of the procedure without actually counting. So
So, are there other people that are in the operating room, the other staff people who also have, responsibilities to prevent objects being left inside the patient? Or does it come down to just that, like, one person whose job it is to do that?
it's the responsibility of the surgeon, anybody assisting the surgeon, whether that's a surgical tech or a resident, and then the scrub nurse.
And how is the use of surgical sponges or towels, like you said, with radiopaque markers supposed to aid in preventing retained objects? And how effective are those?
So the biggest way that a towel or surgical sponge gets left behind is surgeons like to roll these up, use them in the abdomen to kind of block, blood, or keep blood away from the surgical site. And the towels then get saturated with the blood, and so you can't really, at the end of the surgery, discern, difference between, the tissue and the towel. If you're not looking carefully, you cannot see it. Uh, but the radiopaque only helps after the fact. So post after the surgery, if the patient's complaining of abdominal pain, that's out of proportion to what you would have for surgical pain, or it lasts longer, then as I said earlier, like a clamp or a surgical instrument, those are metal, so it's going to show up on an X-ray. Since the towel's not metal, it doesn't show up on an X-ray. So, so radiopaque is that they put, uh, uh, like contrast or something in the towel so that it shows up on an X-ray. So, if the patient's having pain and the doctor does it, it's like, oh well, he shouldn't still be in pain. The surgery was this is too much pain for the surgery that I did, or it's been 2 or 3 days. The pain should be getting less, and it's getting more. Let's do a CT scan of the abdomen, and then they do that, and the towel will show up on there because it's radiopaque means it shows up on an X-ray. That's a translation of radiopaque means it shows up on an X-ray.
So that doesn't really help them to find the towels, in while they're doing the surgery. It's only in the case that it was actually left behind that they'll notice it after the fact.
Yeah, correct. But they can then remove the towel before the patient has months or years of chronic pain, or before it becomes infected. So it does help with that.
What are some of the potential health consequences for a patient when a foreign object is left inside them after surgery, and how are those complications addressed in a medical malpractice case?
Sure. Well, two of the cases that I've been involved with, I mean, we actually had a lot, believe it or not, a lot of retained instrument or towel cases. But two that stand out are, the one is our client did have months and months of just recurrent infections, and instead of looking to see, why he was having these infections, they would just put him on antibiotics, and after a couple of weeks, he'd feel better. They take him off antibiotics, and then a couple of weeks later he'd get the infection again. So he was having recurrent fevers, abdominal pain, and the way they found it is that he went to have surgery because they left the towel in during a surgery to repair his colon, and they had put a temporary colostomy bag in, so they were going to reverse that, and they couldn't do the surgery because he had a fever at the time. So then that's when they finally took an X-ray, and their towel had radiopaque material in it, and then they saw the towel. So then he first had to have the surgery to remove the towel before he could have the surgery to reverse the colostomy. But in that case, because the towel had been in him so long, his intestines kind of grew around the towel, and the towel was kind of embedded, so they had to remove a significant portion of his intestines just to get the towel out. In another case we had, they actually left a clamp in during a C-section that our client had, years earlier, and she went to her mother needed a kidney transplant, and she was a match, and she was going to donate her kidney to her mother. And during the process to vet her to make sure she was a good candidate for the kidney, they found this clamp, and so she had to have the surgery to remove the clamp, which by the time they did the investigation, found the clamp, did the surgery, removed the clamp, and then she needed to recover from that surgery. Her mother had passed away. It was too late for her to donate the kidney. So those are kind of just two examples of what can go wrong when you leave a instrument or towel behind.